Hello friends, I'm Dr. Trupti Kharosekar, gynecologist and fertility consultant from Cure Hospital and IVF Center, Thane. Hope all of you are staying healthy and taking good care in the present COVID-19 situation. Friends, we just recently celebrated our Independence Day, and what most of us yearn for or desire for this Independence Day is freedom. Freedom from the coronavirus pandemic. There is a small group amongst us who is yearning for freedom too. Freedom from infertility. Infertility is the inability of a couple to conceive in spite of 1 year of trying. India, being the second most populous nation in the world, do we really need to bother about infertility? Yes, because infertility is rising slowly and steadily. According to statistics, nearly 10 to 14% of the total Indian population, or nearly 27.5 million couples, are suffering and struggling from infertility today. So yes, it is important. Though both male and female factors may contribute to the fertility issues of a couple, the female factor in fertility accounts for nearly 40 to 50% of the total cases. The reproductive system in females is complicated, consists of the various interplay of various hormones which ultimately act on the reproductive system, which consists of the uterus, the tubes and the ovaries. A dysfunction at any of these levels can lead to infertility. We meet today to discuss about the tubal factor of infertility, which accounts for nearly 25 to 30% of the total cases. So what are these fallopian tubes? The fallopian tubes, the oviducts or salpinges, are nothing but a pair of hollow and muscular structures which connect the uterus and the ovaries. Each fallopian tube is nearly about 10 to 12 centimeters in length and about 1 centimeter in diameter. At the end, it has certain finger-like projections called fimbriae. Internally, the tubes are lined by fine hair-like structure called cilia, which are very important for conception. So how do the tubes help in conception? Well, a series of events beginning from the woman's menstrual cycle or period results in ovulation mid-cycle, which is nothing but a mature egg is released from the ovary. This egg is captured by the fimbriae and transported to the tube. It is here in the tube that the egg and the sperm meet, fertilization occurs and results in the formation of an embryo. An embryo is nothing but the earliest stage of development of your baby. The cilia present in the tubes then push this embryo into the uterus, where it then grows throughout pregnancy. So though the uterus nurtures your baby throughout pregnancy, the initial development of the embryo in the tube and the nutrition provided by the tubal fluid is of utmost importance. So what causes the tubes to malfunction? Well, any disorder damaging the structure or function of the tubes can lead to tubal factor infertility. The most important cause for this is infections. Bacteria ascend up from the vagina into the uterus and can lead damage to the tube. The two most notorious bacteria known to cause this are chlamydia and gonorrhea. Tuberculosis or TB, which is endemic in our country, is also an important cause of tubal factor infertility. Infections cause a collection of fluid in the fallopian tube known as hydrosalpinx, or collection of pus in the tubes known as pyosalpinx, which ultimately destroy the cilia of the tube. Infections can also result in the formation of adhesions or bands around the tubes and ovaries, which can lead to tubal blocks. The other important cause of tubal factor are surgeries. Any surgeries in the past, like appendix, surgeries for intestinal problems, previous cesarean section, can cause tubal blocks. Another important condition is endometriosis. Endometriosis is a condition where the uterine lining is present at abnormal sites outside the uterine cavity. This tissue then bleeds every month, leading to pain, scarring, adhesion formation, and can lead to tubal blocks. A small proportion of women might have absent tubes since birth, that is the congenital causes of tubal factor infertility. One group which needs special mention is women who have undergone family planning procedures or tubal sterilization in the past, but who now want to attempt pregnancy again in the wake of certain events in their life, like loss of a child, remarriage, etc. So now, is tubal factor infertility diagnosable? To diagnose tubal disease is quite tricky because there are no obvious signs of tubal disease. Hence the importance of various imaging modalities to diagnose tubal factor. Let us discuss a few of them here. Foremost, a hysterosalpingography or an HSG, which is nothing but an X-ray of the uterus. A dye is injected into the uterus and the spill of the dye through the tubes is checked and the uterine cavity is checked by taking serial X-rays. It is an OPD procedure with an accuracy of nearly 70%. But yes, it involves certain side effects like severe post-procedural cramping pain, allergic reaction to the dye, irritation of the uterus, radiation exposure. Sometimes it can lead to flaring of infections, etc. A better test would be a sonosalpingogram or an SSG, wherein saline is injected into the uterus through a fine cannula and the spill of saline through the tubes is then checked for. It is relatively a better tolerated test, accuracy of nearly 90%, and does not involve any allergic reactions or radiation exposure. An important test to diagnose tubal factor is laparoscopy. Laparoscopy is the gold standard to diagnose not only tubal but any other cause of infertility. It is a short surgical procedure under anesthesia. A camera is introduced into your abdominal cavity and the uterus, tubes and ovaries are visualized. Advantages of a laparoscopy are any minor problems like adhesions, endometriosis, etc. can be tackled in the same sitting. But in view of it being an invasive procedure, requirement of anesthesia, admission, the cost involved, etc., laparoscopy is often not the first line of treatment or first line of diagnosis for tubal factor infertility. Besides these, there are various other advanced methods of tubal diagnosis, but which would not warrant a discussion in the present forum. Certain blood tests can be done to diagnose antibodies indicating infection, but they might not necessarily indicate a tubal factor. So now coming to the most important aspect, is tubal factor infertility treatable? Yes, tubal surgeries can be offered to certain couples, but the success of this depends upon the extent of scarring and the location where the block is situated. Tubal surgeries consist of excision of the scar tissue, removal of mucus plugs, creation of a new opening or stoma in cases of fimbrial block, etc. Tuboplasty or tubal recanalization can be offered to women who have undergone family planning procedures in the past. There are certain risks associated with tubal surgeries like the risk of bleeding, the chances of formation of more scar tissue, and most importantly, the incidence of ectopic pregnancy increases. Ectopic pregnancy or tubal pregnancies is a condition where the embryo implants within the tube itself due to the damaged cilia. The tube eventually ruptures, leading to a lot of bleeding and needs to be operated on an urgent basis. Now, women or couple who are not candidates for tubal surgery or who have failed surgery are become candidates for in vitro fertilization, that is IVF or test tube baby treatments. In fact, IVF was first developed to treat women with blocked tubes. So what exactly is IVF? IVF is a procedure where you are given injections to grow eggs in your ovaries. These mature eggs are then collected or retrieved and fertilized with your husband's sperm in the laboratory to form embryos. These embryos are then transferred into your uterus and you are given certain medications to favor implantation. So, the processes which are normally taking place in the body in the fallopian tube are carried out in the laboratory, and hence IVF provides a sort of tubal bypass. There are certain advantages of IVF, like it is less invasive than a tubal surgery. The time to conception post-procedure is better with IVF than with tubal surgery. So then what is better? Is it better to do an IVF or is it better to do tubal surgery? Well, the decision depends upon various other factors like age of the couple, the other causes of infertility in the couple, the extent of tubal damage, the costs involved, etc. When we look at the two from the cost per cycle perspective, tubal surgeries are quite efficient. But when we look at it by the success per cycle perspective, tubal factors have a low success rate of nearly 5%, which means multiple cycles of treatment will be required before pregnancy can be achieved. Moreover, the risk of ectopic pregnancy increases with each unsuccessful year of conception. Hence, the decision between tubal surgeries and IVF for each couple needs to be individually assessed and counseled to offer the treatment option best suited for them. Now, before we end this topic, let me discuss a few other doubts which might have crossed the minds of a few attending this. Can tubes be unblocked naturally? Well, there are various natural treatment modalities available which can help reduce the inflammation or swelling of the tubes, like vitamin C, ginger, garlic, ginseng, various fertility massages, yoga, castor oil, etc. But unfortunately, none of them have been scientifically proven to unblock the blocked tubes. They increase your fertility parameters overall though, that way they are helpful, but not for the blocked tubes. Second question, can a woman with blocked tube see a normal period? Yes, a lady sees a period or menses due to shedding of her uterine lining which has no relation whatsoever with tubes either blocked or unblocked. What happens to the egg which is released from the ovary in case of blocked tubes? Nothing, it just degenerates as there is no sperm available to fertilize it. Now the most important of all queries, can a woman with a single blocked tube conceive naturally? Yes, she can, but the chances are halved and the time to conception can be quite prolonged. So friends, in conclusion, we understand that tubes are very important from the fertility point of view, as this is here that human life first begins. The signs of tubal disease are quite subtle and can be often missed. It can be quite devastating to learn about the problem when the damage is already done. But as rightly said, difficult roads often lead to beautiful destinations. So friends, do not lose hope. Believe in science and see your fertility expert who will help you overcome the tubal hurdle. Thank you.